Earlier this week on November 8th, Indigenous Veterans Day, the very first Indigenous Veterans Day, was observed in honor of thousands of Indigenous individuals who have served, protected, and offered allyship throughout Canada's 200-year military history. An important aspect of reconciliation is acknowledging the role that Indigenous peoples have played.
Numerous pull strategies, one of which are the express units that exist across many units to help with that pull from ED. Numerous admit avoids strategies with partners like SE Health to expedite discharges from the emergency department. I mentioned the surge in unfunded bed capacity that we have put in place. Our CAT teams, as most are familiar with, the Centralized Access and Transitions teams, again, to mobilize that flow through the organization.
The President's Advisory Council on EDI was convened in late 2020. The Council is focused on developing recommendations to support a more equitable, diverse and inclusive organisation, but ultimately we're working to ensure that all of our staff, physicians, patients and learners, as well as members of the public, are made to feel welcomed, respected and supported by HHS.
Our current Meditech system requires that staff input a patient's name from their health card only, and for many this name is not the name they use themselves. There is no easy way to document the name the patient uses for themselves or the patient's pronouns. With Epic, we will be able to input a patient's name on their health card for billing purposes while prioritizing the name that they use themselves and their pronouns.
If you are a healthcare worker more than 6 months out from a second dose, you are eligible for a third dose or for a booster dose. You would benefit most of it if you are older age. And obviously there's nothing magic about 70. If you're 65 plus or 65 plus, you probably benefit more than a 20 or 30 plus old.
Training is one of the most critical success factors for Go Live. Everyone, all 13,000 plus, who will be an end user of Epic must be trained before June 4th. Our leaders will soon be instructed on how to register their staff for the classroom training that they'll be required to take.
So our HHS United Way campaign is now really nearing its halfway point, and our goal is raising $90,000 for our organization. And by supporting the HHS United Way campaign, you're helping local community recover and rebuild from the pandemic as we know it.